Good afternoon. I'm Stephanie Gastauer and really pleased to be with you today. I am the talent development leader at Stober Drives in Maysville, Kentucky. And prior to being here for the last 5 years, I was in K-12 education for 22 years. So I hold 2 master's degrees in education. And this is certainly a topic near and dear to my heart. So thank you for joining us this afternoon and listening to our wonderful speakers to get more information about literacy. Beg your pardon. I'll give you a brief introduction of our speakers today. Our first speaker will be Heather Gibbs. Dr. Heather Gibbs is an associate professor and registered dietitian at the University of Kansas Medical Center. She obtained her Ph.D. at the University of Illinois, where she began her work to develop a measurement tool of nutrition literacy. The Nutrition Literacy Assessment Instrument is a validated tool for objectively measuring nutrition literacy in research and practice, and is available in English, Spanish, Portuguese, and Italian. Her current research focuses on implementing nutrition literacy, guided communication strategies in practice to improve patient diet quality and related health outcomes. Welcome, Dr. Gibbs. Our next participant today is Matthew Courtney. Matthew is the policy advisor to the Office of Continuous Improvement and Support at the Kentucky Department of Education. His policy portfolio includes the implementation of federal programs, school improvement, student health and safety, and innovative schooling. We welcome to you as well, Dr. Matthew Courtney. Last but not least is Nichole Huff. Dr. Nichole Huff is an assistant professor and extension specialist for family finance and resource management at the University of Kentucky. Dr. Huff's work aims to improve the financial and mental well-being of individuals and families in and beyond the Commonwealth. Dr. Huff has devoted much of her career to family life education and community outreach, counseling and crisis intervention, and teaching. Most recently, Dr. Huff was named the 2022 University of Kentucky Outstanding New Extension Faculty by the Kentucky Association for State Extension Professionals. Dr. Huff is a trained family therapist whose applied research is designed to educate, equip, and strengthen human relationships. Her research focuses on the intersection between mental health and financial health and includes financial resiliency and coping, improving family resource management skills, and increasing financial literacy across the state. Welcome to you today, Dr. Huff. Thank you all so much for being here. Our first speaker today, excuse me, will be Heather. Heather, if you'd like to introduce your topic and give us an overview of what we'll be hearing today.
Today, I've been charged with talking to you about the problem of food insecurity and what role nutrition literacy can play. Thank you to the organizers for inviting me to talk with you today. I think given the White House Conference on Hunger a couple of weeks ago, this topic is very timely and important for policymakers and public health advocates to get their attention. Because I will be talking about the Nutrition Literacy Assessment Instrument, which has been commercialized by the University of Kansas, I do want to acknowledge that I am part owner of the copyright and receive royalties from its use. So to begin, I want to acknowledge that diet is a health-related behavior that's influenced by a complex mix of factors. And the social ecological model theorizes that these factors, which are illustrated on the screen in gray, influence each other to affect diet at all levels. And in public health nutrition, we're often looking to these indicators, which are shown in white, to gauge the healthfulness of the population and to determine whether our programs are effective. So an important indicator that I will talk about in a moment is diet quality. As a nutrition literacy researcher, I want to acknowledge that most of my work so far has focused on individuals, but I will be turning to public health nutrition education literature to speak to more population effects. So first, taking a more household level view, Vaughn's conceptual model illustrates the complex factors that influence a child's dietary intake and ultimately weight. So please notice that household food security and parental nutrition literacy are only two factors in the pathway to diet quality and child weight. While they are critical factors in the pathway to a healthy diet, and these are the ones that I want to focus my talk on today, there are many other factors that should not be ignored. So let me cover a few key terms first, starting with diet quality. The overall quality of the diet is an outcome that nutrition researchers often measure as an intermediate outcome in the path to health outcomes. Diet quality is often measured by the Healthy Eating Index, and that's outlined in the table on the right on this slide. And this is a quantitative measure of how well actual diet lines up with dietary guidelines. So Healthy Eating Index, or HEI, adds up to a score out of 100. And you can see that the best scores shown on the left are on the fringes of the age span in the United States. And these really aren't very good. So overall, if we were to give a grade, US diets get an F or at best a D rating. So what is nutrition literacy? Much of my early work has focused on measuring nutrition literacy so that we can study its effects and how to potentially intervene. So this is a visual representation of the knowledge and skills that are measured in the nutrition literacy assessment instrument, or INLIT. Nutrition and health is the first subscale shown in the left corner, and this measures ability to apply text information about nutrition. Energy sources in food focuses on ability to choose food for the amount of carbohydrate, protein, or fat. Household food measurement assesses ability to correctly portion foods. Food label and numeracy measures use of a food label and ability to apply numbers. Food groups measures ability to use a food guide to plan a healthy meal, and consumer skills measures ability to choose between similar food products. So we collected nutrition literacy and self-reported diet intake in 386 adults with nutrition-related chronic disease in the Kansas City metro area. And we used a principal components analysis process to identify distinct dietary patterns as it relates to measured nutrition literacy. So in this figure, the line of 0 shown right here in the figure separates what was eaten on the right from what was not eaten on the left. So on the right side of the line are foods that were eaten in higher proportions in the diet. And you can see that those with high nutrition literacy ate a healthy diet characterized by orange and red vegetables, nuts and seeds, low-fat dairy and olive oil, whereas those with low nutrition literacy ate a more typical US diet with far more fried fish and shrimp, processed meat, sugar-sweetened beverages, and refined grain. And we've seen similar results in multiple studies where nutrition literacy is positively related to diet quality within a sample. And so as nutrition literacy increases, diet quality increases as well. But nutrition literacy is likely influenced by social determinants of health. So in that same sample, I've shown here the poor nutrition literacy group, and what you can see is that this group was older, more often male, with lower educational attainment and with lower incomes. So the third term I want to discuss is food insecurity. The USDA defines food insecurity as a household food level economic and social condition of limited or uncertain access to adequate food. I'm looking at the chart. A food secure person, which is indicated by the green bars, can report 1 or 2 indications of food insufficiency but does not experience a change in dietary intake. Low food security, shown in the light blue bars, and very low food insecurity, very low food security showed in the dark blue bars, are both considered food insecurity. However, very low food security shows multiple indications that food insufficiency results in disrupted eating patterns and food intake. And you can see that these disruptions to food intake, as we go down the list of questions in this chart, increase. So to clarify, hunger is a physiological condition that can result from food insecurity. When lack of food persists, the discomforts of hunger persist and go beyond the usually temporary hunger sensation. So about 5 million or 3.8% of US households had very low food security at some time during 2021, and 8.4 million or 6.5% had low food security during 2021. So combination at that point was about 10%, usually hovers around 12%. This chart from the USDA shows the relative prevalence of food insecurity, with higher than average rates in the states in dark orange, which includes Kentucky. And this chart illustrates the prevalence of very low food security by household characteristics. So here we can see that low income is the most common factor, but also see that single women with children and Black non-Hispanic households more often experience very low food security. Given that food insecurity limits access to a healthy food supply, it should be no surprise that there are health consequences for adults and children. So iron deficiency anemia, chronic diseases, and mental health consequences are more prevalent among persons living in food insecure households. So now that I've defined diet quality, nutrition literacy, and food insecurity, I'm going to try to address this question on the slide. I do want to give the caveat that I have not collected data to directly answer this question, nor have I seen any intervention studies that directly answer this question, but I do have some related work underway. However, I think that the SNAP, or the Supplemental Nutrition Assistance Program, formerly known as food stamps, may be a good model for us to look at to consider the additive effect of nutrition education for low-income families who receive SNAP benefits. SNAP is the largest federally funded program to provide food assistance to low-income families, although there are 15 federal nutrition assistance programs in the United States. It is known that there is a self-selection bias where those who receive SNAP benefits are more likely to report food insecurity. So researchers at the USDA showed in these data on the slide that households tend to self-select into SNAP during their peak in food insecurity, where after entry into the program, food insecurity rates decline. So although SNAP does not completely ameliorate food insecurity, it does appear to be decreasing food insecurity among those who participate, in other words, allowing them to become more food secure. However, when it comes to diet quality, a systematic review of 25 studies evaluating the nutritional intake of participants on SNAP compared to a comparison group had mixed findings. And this table from the study illustrates how different aspects of diet intake compared between SNAP participants and low-income non-SNAP participants. It's a busy table, so I've tried to highlight a couple of notable takeaways. So overall, those receiving SNAP benefits were either similar or lower in overall diet quality. However, less food was eaten away from home, which is a behavior that generally lowers food costs and tends to be more healthful than eating outside of the home. On the negative side, there are some indications that there is a higher intake of sugar-sweetened beverages. And while I haven't shown here, there is another data table that includes children, which appear a little bit more positive. And this is where SNAP education really, I think, is beneficial. So while the goal of SNAP is to reduce food insecurity in households with low income, the goal of SNAP education, or SNAP Ed, is to improve the quality of diets to decrease obesity and risk of chronic disease. Because participation in SNAP education is not required of SNAP participants, it's just an added benefit, studies can ethically be conducted to evaluate the causal relationship between nutrition education and improved diet quality within the context of low-income households. I do want to point out that the funding for SNAP education was only about 0.4% of the budget compared to SNAP food assistance in 2021. The strongest evidence for a causal relationship comes from randomized controlled trials, but these are very expensive to conduct and few have been done within the SNAP context. So evidence from one randomized controlled study conducted in Indiana demonstrated an improvement in food insecurity status in SNAP Ed participants versus SNAP recipients who received food assistance but did not participate in SNAP education. So in this study of 575 adults from low-income Indiana households with more than one child living in the household, participants were randomized to intervention or control. The intervention group was required to attend at least 4 lessons of the SNAP Ed curriculum, either in their home or in a community setting. And participants in the control group received intervention materials 1 year from baseline after completing the 1-year assessment. And for those who completed all assessments, both groups improved their food security. However, the group receiving SNAP education improved food security by 25%, which was significantly greater than those not receiving SNAP education. In terms of improving food behaviors, for the past several years, SNAP has been especially focused on increasing fruit and vegetable intake. And there have been several studies within SNAP education demonstrating improvements for those receiving various levels of education. And so you can see a half-cup improvement in fruit and vegetable intake, and this is pretty consistent across fruit and vegetable interventions from nutrition education. I also wanted to show you the successes reported by Kentucky SNAP Ed in 2020, and you can see that participation rates in the top left, improvements in food group intake, physical activity, food safety, food resource management, all show improvements in food and nutrition related behaviors that decrease food security and are associated with improved diet. So this look at the SNAP and SNAP education program illustrates that while increasing access to a healthy food supply improves food security, nutrition education further improves food security and is also needed to improve dietary behaviors. So what approaches should be used to design effective nutrition education? Well, Baker and colleagues organized this framework to describe best practices in nutrition education for low-income audiences to promote equity and effectiveness. And they outline key elements of program design, program delivery, characteristics of the educators, and use of evaluation at all stages of the planning and delivery process. So since I walked you through the benefits of SNAP education, I think it's also useful to consider their educational targets. So SNAP Ed is required by law to use evidence-based interventions to improve healthy eating, increase physical activity and reduce sedentary behavior, improve food safety and food resource management skills. And I just want to point out that most of the outcome data that I showed you a few slides back collected by Kentucky SNAP Ed relate to acquisition of these concepts. Then looking at my work for just a little bit, my nutrition literacy research has focused interventions at the individual household level in a couple of pilot studies. And I want to share just 2 approaches that I've used. So the first approach is to target intervention for low nutrition literacy audiences, just across the board. And so this is the best approach to use when working with a general adult population. So Nutricity, which I'm showing here on the slide, is a mobile health intervention that's aimed at parents of 1 to 5-year-olds and their 1 to 5-year-old using techniques aimed for low nutrition literacy audiences to improve diet quality regardless of nutrition literacy level. And it includes a mobile website that provides brief information and guidance to support nutritious decision-making in 3 environments: the restaurant, the grocery store, and the home. And it's delivered in English and Spanish. Because so much of diet intake is influenced by behavior, Nutricity also includes a behavioral component to support application of educational concepts. And so using text messaging, participants of Nutricity set weekly nutrition behavior related goals based on the educational messages that are found in the mobile website tools. We also evaluated diet quality at baseline at 3 months of intervention in the study. And so I want to caution you that we did have a small sample and limited power to look at differences. So although we did not see improvements in ATI overall, the range was pretty substantial, and there were some who had change, but they were just in both directions. So looking at the component scores, I think here is a little bit more helpful, and we did see improvement in 2 components. We were most excited by the improvement seen in dairy. So looking at that more closely, we found some impressive increases in dairy foods that explain the differences. And improving dairy, especially milk intake here, for children is meaningful because of increased calcium, protein, and other beneficial nutrients found in dairy foods. So we were encouraged by these preliminary data. Another approach is to measure nutrition literacy to tailor messaging accordingly. So we've also completed a study with outpatient dietitians, the idea being that when a dietitian has access to nutrition literacy scores, they can tailor educational messages according to specific nutrition literacy needs. So going back to the inlet tool, which I outlined before, each subscale measures specific nutrition skills, which I talked through before, but have put in text here on this slide. So we piloted this idea in outpatient nutrition clinics, and the RDs were trained on how to adjust nutrition messages based on nutrition literacy assessment, and then they were randomized to either receive their client's nutrition literacy score or not. So both arms improved nutrition literacy scores slightly, but what was particularly encouraging was that after only 1 encounter, both groups improved nutrition behaviors, and the group in which RDs were given nutrition literacy scores saw improvements in more nutrition behaviors. So I know I've taken us on a quick journey to answer a complex question, so I want to give a couple of concluding thoughts. First of all, there's no question that nutrition literacy and food security are both factors that are influenced by social determinants of health. Food insecurity, by its very definition, results in poor diet quality. Adequate access to a healthy food supply is foundational to supporting food security. However, nutrition literacy is an additional supporting factor that is important to achieve diet quality. And tailoring interventions to reach individual nutrition literacy needs is an approach that can improve food behaviors when working with individuals. So thank you so much for your time. I look forward to your questions and the panel discussion.
Thank you so much, Dr. Gibbs. So much information, quality information about social determinants of health in regard to nutrition literacy. We do have an opportunity. If you all have questions, please make sure that you feel free to put those in the chat. And then at the end of all of the presentations, we will go back for a question and answer. So feel free to ask any questions that you may have to our panelists in that chat. The next presentation we will have is Dr. Matthew Courtney. So welcome, Dr. Courtney, and please feel free to take control.
Right, thank you. And good afternoon, everyone. Thank you for logging into this meeting today, and thank you to the Foundation for Healthy Kentucky for bringing us all together to talk about how we can use education to improve the health and quality of life for all citizens in the Commonwealth. My name is Courtney. I'm a policy advisor at the Office of Continuous Improvement and Support at the Kentucky Department of Education. And I was asked to come in today and talk to you a little bit about some things that are happening from the Kentucky Department of Education in schools across the Commonwealth to try and create a safer, more healthy school environment for our students so that they can learn. We know, and I certainly don't need to explain to this audience, that we know that a healthy learning environment is vital to the long-term success of our students and helping to ensure that they can learn and grow and achieve all that they want to achieve in life. So I'd like to begin my presentation by just reflecting back on a piece of legislation from 2019 that has really shaped a lot of school health and safety work in Kentucky, and that is the School Safety and Resiliency Act. This is an act that, like I said, was passed in the 2019 legislative session. Of course, later that year, we would start the COVID-19 pandemic and delay some of our implementation. And we're really in a position now across the Commonwealth where schools are really beginning to fully implement the various elements and expectations of the School Safety and Resiliency Act. You're going to see that in your schools when you see schools talking about things like increased student mental health access, or things like district level school safety coordinators. These are full-time staff positions that are dedicated to creating and maintaining safe and healthy working and learning environments for our students. A few things from the department's perspective that we're working on related to the School Safety Resiliency Act first comes into play with our trauma-informed plans. As of last summer, every district in the Commonwealth is required to have a trauma-informed education and trauma-informed discipline plan that has been adopted by their Board of Education. And you should be able to access those by going to your local school district website and doing a search on their website for that phrase, trauma-informed plan. You should also have heard discussions around trauma-informed plans in Board of Education meetings, local Board of Education meetings, or planning meetings. These plans really help a school district think through how they're going to provide support to students who have experienced trauma. And I think it is so just fascinating the way that life plays out, that we would create this trauma-informed plan requirement in 2019, and then we would live through 2 years of global collective trauma. And so as schools are coming back into session this year and they're getting their feet back underneath of them, those trauma-informed plans are more important than ever before, because we know that every student entering our school is a victim of trauma from the last couple of years, and some of them have a great deal of trauma as they have lost loved ones and relatives and friends due to the pandemic. Social isolation from the pandemic has created trauma. And so those plans are really important. One of the ways that the Department of Education is supporting the development of those plans is through our trauma-informed toolkit. And you can find that very easily by going to the Department of Education website and searching trauma-informed toolkit. Through this toolkit, we have developed and curated resources that are evidence-based, that have been shown to improve outcomes for students. And we've provided this toolkit as a resource for schools and districts to help them really educate themselves and build greater skill for themselves in working with youth in a more trauma-informed way. One of the most important elements of that is our trauma-informed discipline work, really helping educators to understand the root of disciplinary issues in schools, understand the relationship between trauma in schools and disciplinary actions, and helping educators to be equipped with new resources and strategies for coping with and dealing with behavioral difficulties in their classroom in a way that doesn't exacerbate underlying trauma that may have led to that behavioral incident. And I see that our colleagues from the foundation have put the direct link to that trauma-informed schools page right in the chat for you. As we think about trauma-informed discipline, another element that the department has taken on recently is new regulations related to the administration of corporal punishment. We are one of just a handful of states that still allows corporal punishment in our state statutes, and only the legislature has the ability to prohibit corporal punishment directly. And so the department we found ourselves kind of in a position where, on one hand, we are talking about trauma-informed discipline, we're creating resources and toolkits, schools are adopting plans, but then we have to balance that with this statutory permissive language around corporal punishment. And so in the spring of this year, we promulgated a regulation related to corporal punishment and how that is administered. We took a harm reduction approach to that, borrowed some elements of harm reduction principles from substance use policy world, applied that into this context to try to make corporal punishment safer for kids, as safe as we can make it be in our situation. The department understands, and it's our position, that corporal punishment is not safe. It is not trauma-informed care, and we should not be using corporal punishment in our schools. But again, it's out of our scope to be able to prohibit. So we applied harm reduction principles to try to make it safer for students and schools who experience that. One artifact that you should be able to see locally of that is that every local Board of Education is now required to adopt a corporal punishment policy that's part of their official Board of Education policy book. And what this does is that introduces corporal punishment back into the conversation at the local level. Those boards of education will have to discuss corporal punishment and adopt a policy, which gives opportunities for practitioners and professionals in the community to weigh in, to provide public comment and a voice on how corporal punishment should look in a district. It also provides clarity because we had heard from families that they didn't know corporal punishment was being used in their district or in their child's school. And so this creates a level of transparency so that now through this policy, families and community members will know, one, if corporal punishment is happening at all, and two, if it is happening, under what conditions will it be happening, and what's it going to actually look like. We've also really increased parental involvement notification processes in that. And so we think that that's really going to help support our youth who are experiencing corporal punishment and reduce the harm that that brings to them. Another element of our work in terms of supporting students and trying to create a safe environment is some new work that we've launched over the summer around LGBTQI+ youth. We know that, especially after the pandemic, that is a population of youth that is at higher risk for many mental health conditions. They are a higher suicide risk as well. And so we have provided resources and tried to create some resources and also curate some resources related to LGBTQI+ youth and helping educators understand more about this population. What we have observed is that we really have an information gap when it comes to hard facts about the LGBTQI+ population. And so we're working diligently to provide more information and upskill our educators so that they are more aware of the social challenges related to this population, the inherent risks that come with our societal structures around LGBTQI+ youth, and provide them with some tools and strategies to respond when they have LGBTQI+ youth in need. So we're very proud of that work. And again, all stemming from that really groundbreaking legislation in 2019, the School Safety and Resiliency Act. That is a truly groundbreaking piece of legislation. It has become a national model for states across the country looking at creating trauma-informed and safer environments for students. The last thing that I'll talk about this morning or this afternoon that I'd like to kind of leave you with is a sort of teaser for some pre-coming work that we're going to see in the next couple of months from the department. And that is a new grant program called the Stronger Connections Grant. The Stronger Connections Grant is a federal program that was created by the U.S. Department of Education, and the federal legislature following the Uvalde shootings, and really is a grant designed to improve school resources for student safety and particularly mental health. In Kentucky, that's going to be a $15 million competitive grant that districts will be able to apply for. Only school districts are eligible for that grant. But part of that grant process is that those districts are required to reach out to local community practitioners to solicit input from their community about how to create a safer and healthier environment for schools. So I would encourage everyone here today to be on the lookout for news alerts and notifications. Follow the KDE on social media, follow your local school districts on social media, so that as that Stronger Connections grant becomes available and districts begin to apply for that, you'll be aware of that and be able to contribute to that conversation. Again, that's $15 million. So that's going to do a lot of good for districts. It will be a competitive grant, and that will probably come out in January through March, that kind of window is when districts will start to apply. And then I would also say you'll have an opportunity to comment on the state level, sort of on our plan for rolling this out and our priorities under this grant. That will be open for public comment in the next couple of weeks. So we would love to hear from you if you think that there are priority areas and things that we as an agency should consider as we are designing this grant and running our grant competition. So with that, that's my time today. I want to thank you all again for your time and attention. And again, thank the Foundation for Healthy Kentucky for bringing us all together. And I'll be on the call to answer questions at the end. Thank you.
Excellent. That is a lot of very positive news, I think. Dr. Courtney, so many opportunities for us to influence and impact policy change regarding literacy as a social determinant of health and bring health equity throughout our community. So thank you so much for your information. Last but not least, we have Dr. Nichole Huff with us this morning talking about financial literacy as a determinant of social health. So Dr. Huff, welcome, and we look forward to your presentation.
All right, thank you. Okay, I am losing my screen when I maximize, so give me just a second to get the screen share working well. Okay, now I think we're ready to go. I am Dr. Nichole Huff. I am an assistant professor and extension specialist with the University of Kentucky and with Kentucky Cooperative Extension. And so I'm going to be talking today about outreach, and so specifically financial literacy as a determinant of social health. And so as we consider health and we consider learning options beyond K-12, and when we look at lifelong learning and how to extend our health access, I want to challenge us to consider a broader definition of health. And so one that includes financial literacy. And so I'll talk to you about what that extension arm. So I'll specifically talk to you about cooperative extension, but just what community-based outreach looks like and how to extend our education and access beyond a classroom. And so as we consider social determinants of health, there are 5: education and access and quality, healthcare access and quality, neighborhood and built environment, social and community context, and then economic stability. And so when we consider financial literacy, we often want to put it in the economic stability category, and it absolutely fits there. But it also fits across different determinants of health, because our finances and our financial health, so both our financial capital, but other types of capital, human capital and social capital, and different types of family resources that are necessary to manage across the lifespan, can't be compartmentalized just to one avenue of social determinants of health. Because we know that with healthcare, we have to navigate insurance systems. We have to, with neighborhood and built environment, consider housing options, affordable housing. We have to, with social and community context, we have to overcome economic hardships, but also these community models of poverty. And I'll talk to you about that. With education access and quality, it includes K-12 education, but it also includes educational access throughout one's lifespan. And all of these contribute to the economic stability of the individual, but also the economic stability of the community. And so again, where does financial health fit along these? And I hope that by now you're seeing and that you are considering that financial health, it goes across all areas. And we know that financial literacy can impact the social determinants of health, especially when we're looking at resources for individuals who've experienced economic hardship and poverty. And financial literacy is often much lower in these populations. And so what we want to do is to enhance financial literacy so we can also enhance financial wellness and financial health. And we'll look at what that looks like, and we'll operationalize some of those concepts. Because, we also know that exposure to prolonged economic hardship has detrimental impacts on an individual's health and well-being. And one of the things I love about cooperative extension and the role that I get to play in community-based education is expanding this educational access. It's moving from just literacy to capability. It's moving from, so in terms of financial literacy, just understanding concepts and terms and navigating systems, to actually being capable enough to put that into practice, because it is our actions, not our knowledge alone, that will impact our health and our ability to have individual health, household health, community health, and whatnot. And so I'm really interested in finding more comprehensive solutions that look at improving financial literacy. And so not only, a lot of the research on social determinants of health, it looks at access, and access is, it's huge, right? And having barriers to our access for education and food security and insurance and health access and good health care and educational systems. If we don't have access, right, we're not even at the game. So we can't play the game because we're not on the team. So focusing on access is very important, but what do we do after that? And how do we move from these siloed areas to look at comprehensive programming and education that takes into consideration that human life doesn't occur in a vacuum. And instead, we need to look at the interplay, that intersectionality between these social determinants at health so that we can focus on more comprehensive well-being. And so as we operationalize some concepts today, let's start with financial literacy. I know that the first speaker spoke to us about health literacy. And so financial literacy can be defined, and I'm going to read this, right? And I've broken it down because it is a complicated term. And so understanding financial concepts, so that's everything from the tax system here and filing taxes to navigating insurance to any and everything that requires financial capital. So understanding those concepts, as well as the ability to manage our finances, both in the short term and in the longer term in terms of financial planning, within the context of changing economic conditions and life events. So clearly that is a very easy task, right? So financial literacy could be summed up in a workshop or in an extra class that a student has to take, maybe to meet K-12 standards. And I hope you catch my sarcasm here, because understanding financial literacy is extremely complex to the point that most literature cannot agree on a definition. And this is a really good definition of financial literacy, but it hints at its complexity. right? And so it is very complex. I am currently teaching an undergraduate class at the University of Kentucky on basic financial literacy concepts and an introduction to personal finance. And we barely scratched the surface in an entire semester. And so to expect, especially disadvantaged portions of our population and children in the households of these portions of our population to understand financial literacy, to navigate all these nuanced aspects it's a very hard task. And so how we can address that in a way that can really affect change is going to be important to, not just at a micro level, but at a macro level as well. Because our goal really is to move from financial literacy into that financial capability, right? So from knowledge to action, because what we know is that increases our financial health and our financial well-being. And so financial well-being is a state of being wherein a person can fully meet those current and ongoing financial obligations, that they can feel secure in their financial future, and that they can make choices that allow them to enjoy life, right? So finances should not only be a source of stress in our life, but it should be a source of freedom as well. And so when we are looking at equal access and equal opportunity, we also want everyone in society to have that equal access and opportunity for health and well-being, for financial wellness, not just financial literacy. So there are, the Consumer Financial Protection Bureau looks at 4 elements of financial well-being. And so that is the ability to have control over your day-to-day and month-to-month finances, to have that present-day security, but also that future security. So to be able to have the capacity to absorb a financial shock. And then the past 2 years and counting, right? That is testing all of our future financial security, all of our ability to handle a financial shock. And so, but what we know and what research and data tells us is that most Americans and most Kentuckians, I'll speak specifically to the Commonwealth, are not prepared to handle and absorb a financial shock. And so we often can't be resilient in adverse times because we don't have that underpinning of financial security. All right, so the other 2 elements of financial well-being is this idea of freedom of choice, both for the present and the future. So having that financial freedom to make choices to enjoy your life. And now we won't talk today about priorities, and it's really important to have priorities with spending, and that's part of financial literacy, right? So that we are not enjoying life at the expense of not paying our bills, or we're not enjoying life at the expense of going without a medical need or another health need. That would not be exercising good financial capacity and good financial capability. But we should be able to pursue freedom and happiness, and money can inhibit us, but it can also allow us to do those things. So both in the present, but also the future. So an avenue of financial well-being is being on track to meet your financial goals down the road. So retirement is a good example of that. Are you going to be able to retire? And are we equipping that financial narrative across the lifespan so that by the time an adult reaches the age of retirement, they are financially ready? And we can't wait until we're in our 40s to have that conversation, or our 50s or 60s, right? This conversation needs to be started early. Because financial health influences our physical and mental health. And so because so much of our livelihood is tied to our finances, when we experience economic hardship, especially prolonged exposure to economic hardship, then we have financial distress. And so for some of us, that could just look like the pandemic, right? A life disruption. And so that was a big one. But it could look like losing a job, or not having that access to adequate health care, or not understanding the social systems that allow you to access health care if you don't have the resources, or not understanding where to go if you can't put food on the table for your children. From a little to a large stress, when money is involved, it can be extremely vital, and especially to a volatile lifestyle. And we know that financial literacy and financial wellness can increase our overall health, both financially, but also physically and mentally, right? We're more able to perform our job if we are not stressed about our finances. And if we're not stressed about our finances, we're more able to enjoy life. And we know that there are so many social determinants of health, but just how interconnected all of those portions of health are. And so one model that looks at financial health, it really looks at it as the foundation. And so again, and various aspects of financial literacy include understanding spending and how to spend wisely, how to save for short-term and long-term goals, how to borrow so that you can build equity and assets, and you can build your net worth. And so the ability to navigate the credit system and to have a credit history so that you can borrow, for, whether it's for a car, a home, anything that you would need that. Also to plan for the future. So those aspects of financial literacy really undergird financial health, which is so tied to economic security, housing security, and food security. And so what I like about this model is it doesn't presuppose that our security, our energy, housing, food, different health access is what undergirds the model, but instead our financial health. And so it's a flip narrative that is worth exploring. And before we talk about solutions, because that is coming, is looking at our economic report and some stats that are in the Prosperity Now scorecard for Kentucky for 2022. And so our richest 20% of households in Kentucky make nearly 5 times as much income annually as the poorest 20%. And so the gap between the economic continuum is very large. And when you are in that poorest 20%, it can be very hard to overcome some of those financial statistics that are just out of your control for the most part. And 38%, almost 39% of Kentucky households live in liquid asset poverty. And we know that liquidity and having liquid assets is important to resiliency and being able to navigate challenging financial times. We know that almost 30%, so 29 or 27% of Kentucky households are unbanked or underbanked, which means that they are not accessing financial institutions, banks, credit unions, that they may be credit invisible or have a poor credit history, so they cannot navigate any of the markets that would allow them to build personal wealth, or that they may have very minimal interactions with the bank. And so they may be using cash advances or other types of predatory lending practices that have very high interest rates that continue that cycle of oppressive financial behaviors. And then we know that combined, many of our renters and homeowners are extremely cost burdened. And right now with the rate of inflation and the cost of living, not knowing how to navigate volatile financial times is really crucial to everyone's health and well-being, but especially economically disadvantaged populations. So this is a small snapshot. You may not be able to see it on your screen, but it just looks at a cost of living estimate for Kentucky households It looks at a median income for a renting household, regardless of whether you have dependents, is around $3,000. Okay, and so that gives you very low budget for rent or housing. So maybe $860, $250 on food, $140 on transportation, $100 on utilities, $500 on childcare, $163 on debt, and that's just looking at average debt load for Kentucky households. So that gives you about $900 to spend. And so a month. And what that doesn't account for is what happens when you have dependents, what happens when your rent and other housing costs is above that. We know right now $250 worth of groceries doesn't go very far. The same with transportation costs as we are navigating very challenging financial times. And so with any kind of discretionary income, if we were to look at, and so what the bottom half of this chart looks at is how costly emergencies or unexpected costs could be. So a month's savings could go all towards a new tire if you have a blowout or need to replace your tires, or have to have car repair, or have to have medical expenses. And so it begins to estimate how quickly it is to go belly up. And this is very, very low or low estimates. All right, and so I want to wrap up by just talking about how do we affect change then, right? So what? So here are the problems. What do we do to generate a solution? And the first is to look at these community models of poverty and the distinctions between middle class and lower class. And again, some of this may be small on your screen, but where we see the types of businesses. So if you were to imagine your neighborhood or your community, your town, your city, if you were to think about a lower class neighborhood, the kinds of businesses that would be there, maybe pawn shops or liquor stores. You may have rent to own businesses, laundromats, check cashing businesses, more fast food establishments, more used car lots. Whereas if you consider the model of poverty and what a neighborhood might look like for the middle class, you may see your library, your bank, your fitness center. You may see vets. You may see a shopping mall. And so your community models are going to look very different depending on your socioeconomic class, right? So that can make it very difficult to rise above those levels of poverty. And so you also see differences in value that are a part of our community models of poverty. And so we know that relationships are highly valued among disadvantaged populations. And so how can we then, as community-based professionals, affect change? And so one, we can capitalize on those relationships. And so the school system, social services, someone like me in community extension, our faith-based communities, our policymakers, our public service officials, we are the effectors of change essentially. And what can we do about it? And increasing access in community-based education is one solution, as is beginning to see systems, right? And so we look at that socio-ecological model, but also a family systems model that if even though that hole is not in our end, we're still going to sink if we don't address it. And so seeing community change as realizing we are all in the same boat. And so by finding solutions, it helps us all. And so beginning to become professionals who see systems. All right. And so if we were in person, I would have a dialogue right now about what do you see here? You see some butter and some flour and some cocoa powder and water and milk, and you see the ingredients for a cake, right? And so the Gestalt principle is that these ingredients are important, but on their own, they are not as important as the sum of their parts. Because if I were to go take me a big bite of flour right now, it would not taste like a chocolate cake, right? And so when we are seeing systems in our community and we want to improve our community, we want to look at policy. We want to look at healthcare and all the different determinants of social health. We want to look at finances. But what we want to do is look more on the integration. We don't want the cocoa and the butter. We want the cake. And when we are looking at investing in the lives of others, of Kentuckians across the lifespan, we don't want to just, we don't want to focus on the ingredients. We want to focus on the integration. And depending on the quality of ingredients and the quality of healthcare access, you know, we could get two very different cakes, okay? So it doesn't always mean that our end result will be perfect, because life is not perfect. And we, again, humans don't exist in a vacuum. But either one of these cakes is still far more resilient than the ingredients alone. And so when we are looking to affect change, when we are considering things, especially financial literacy and policy change and social determinants of health, look at them as using really quality ingredients so that when we put them together, we can teach people how to have that better end product. And understanding navigating those systems is really important. And so I want to wrap up by just plugging Kentucky Cooperative Extension. I am an extension specialist with the University of Kentucky. And many people, although we are hundreds of years in the making, are not familiar with the community-based resources that Kentucky Cooperative Extension can offer. And so our mission is to serve as a link between the counties of the Commonwealth and the state's land-grant universities, so Kentucky State and the University of Kentucky, to help people improve their lives through an educational process focusing on issues and needs. So we program for the needs of our people. We work to educate our people so that they can go out and move from literacy to capability. And so we translate science, like some of the research you've heard about today, but into digestible pieces of information that the community can put into practice. We are in all 120 counties. And so if you are not currently partnering with your county extension office, I would encourage you to make that connection, because we take and provide research-based education in community programs. We form community partnerships and coalitions, and we are a grassroots organization. So we have state-supported specialists, but we also have agents in all of our counties who are there help to determine the needs of those populations. So we have community offices, but we also take education into school systems, into community buildings, into healthcare facilities, and we look to create those partnerships, or we can bring organizations into our buildings to make education accessible. And particularly, I work to make family finance and resource management accessible. We have our MoneyWise initiative, which is a financial literacy initiative for all Kentuckians. We have a monthly newsletter with the reach of about 80,000 or more. We work on financial literacy and resource management skills, but we also do things like Recovering Your Finances, which is a program I want to plug, and some grant funding we have from USDA NIFA for the Profit Grant to promote recovery online through financial instruction and addiction training. We will be launching across the state and across the nation within the next calendar year to train healthcare and community-based educators to deliver financial literacy information to substance use recovery audiences. Because again, we see intersectionality. We know that that when our finances are strained, we are more likely to experience relapse. And it is one way we are using financial literacy to combat the opioid and other drug epidemics here in Kentucky. So Just last slide here is to really see individuals as part of dynamic systems, to build on the academic standards for financial literacy so that we can continue to provide lifelong learning, to equip our households to successfully manage and navigate those social programs like nutrition education programming or like other types of assistance programming. How do people know what they're eligible for, how to use these systems, how to navigate these systems? And so the importance of not just access, but education so that we can lead to action. And all right, so that is it. I'm gonna stop my share because I know we have a few minutes for discussion.
Excellent. Thank you so much. Gosh, just a vast wealth of information for our communities to think about. I love all of the perspectives, and it just gives us so much more energy to focus around the opportunities that we have as a community to really come together and lower those silos and increase the sharing capability and making that access equitable. So we know through most of us who are familiar with education, Maslow before Bloom. So we really have to make sure that all of those needs are met before our brain is able to then learn in healthy environments. So everything that you've discussed here today is so energizing. And I thank you all for your hard work and diligence in meeting the needs of all Kentuckians. If you have any questions for our panelists, please don't hesitate to put them in our chat. There are a few that I'm gonna reach out and convey. So, pardon me, Dr. Gibbs, this is for you regarding SNAP education. And one of our participants asked if SNAP education could be sort of a prerequisite or requirement for those who are receiving SNAP benefits.
Well, so SNAP education is not required for SNAP participants. And I think the thought behind that is that access to a healthy food supply is a basic need. And it is not it is not like WIC, where the Women, Infants, and Children's program does require that a person receive education in order to also receive the food benefits. So it's intentionally set this way so that a person doesn't have to jump through additional hoops to be able to get adequate access to food or supplemental food. But the education piece is an added benefit that they can participate in, which does show some added benefit in terms of food security as well as diet quality.
Excellent. Thank you so much. And so as we move from knowledge to action, I think that's a great point to have made. Any further discussion points that you guys would like to have in terms of final thoughts, or any participants with additional questions? Oh, we've got some coming in. So for Matthew, what's the timeline for opening the Stronger Connections grant?
Thank you. That's a great question. We're still waiting on some final rules from the U.S. Department of Education that will govern how we administer that program. We do know that by the end of the calendar year, we have to solicit public comment from the state agency about our plans for administering. So we will be, of course, establishing priorities and giving certain kinds of bonus points for certain kinds of community features. And so you can expect to see that go out for public comment, I would say, in the next maybe 2 or 3 weeks. And then schools will probably not actually have money in their hands until August or September. Next August or September, we will have to run a full competitive cycle. That takes a long time. But hopefully by the next school year, those schools will have access to that money.
Awesome. Thank you so much. Would the home extension program be willing to include a program on taxes and the effect of reduced income taxes on the Commonwealth?
Yes, absolutely. And so, like I mentioned, cooperative extension, we program for needs. And I can always, a program is much easier to design if I know the need. And so what we encourage counties to do, if you have a specific need, to get in touch with your with the Family and Consumer Science agent at your local cooperative extension office, who would then act as a go-between between the state office and like myself and them. And so we would work together if a program doesn't already exist to design one that could be delivered locally in your county. And if that's a need, then yes, we could work to create a program to address that need.
Awesome. Thank you so much. Matthew, regarding trauma-informed schools, how do you foresee the approach changing in response to changes in data?
So we do a lot of work at the department on helping districts and schools understand their data and understand what that data is really telling them. And we see, when we think about trauma-informed education, the data where you're really going to see the most trauma most clearly is through our behavioral data collections, because that is how the students express their trauma in the classroom. And so one of the things that we do is it's called a report called the Annual Safe Schools Statistical Report. And you can access that, of course, from our website. The current one it's always a year back, right? So the one for last school year will publish this December. And it goes over the last 5 years, and you can see changes in data. We can see changes in substance abuse and use in schools. We can see changes in aggressive behaviors, violent behaviors, behaviors with weapons, on-school property, off-school property. So a lot of really interesting detailed information, and we encourage our schools to use that and as a sort of metric of how well they're doing at meeting those I don't want to say non-educational needs, but those maybe academic needs of our students, that all those wraparound services that they need to really be successful.
Excellent. And usually those are housed in regional prevention centers. So the conversations can partner with the mental health providers too. Is that correct?
Yeah, there's lots of opportunities for those regional mental health providers to collaborate with their school leaders.
Wonderful. Thank you. Nichole, would the home extension program be if you would pardon me, that is the second this is the second time I've read that question, so you don't have to answer that one again. So thank you guys. Do you have any final thoughts surrounding what we've heard today and sort of bringing everything together and aligning and marshaling all of our forces to make sure that our families in Kentucky really have that equitable access and meeting everybody where they are in that trajectory of Maslow and development?
I would just say that you know, your local school districts have a lot of agency and a lot of power when it comes to these elements. And so I would encourage you to engage with your locally elected school board officials, attend those local board of education meetings, watch for those alerts so you can see when are they going to talk about the trauma-informed plan, when are they going to talk about their corporal punishment policy, and show up and lend your voice when you have those opportunities.
Excellent. Thank you so much. All right. Thank you guys for participating today. Your expertise has been wonderful, and we appreciate you spending your time with us this afternoon to share. Have a great day.
Thank you.